Is one session of acupuncture worth it? What are the forbidden points of acupuncture? All right, this is a bit of a controversial one. And let's not just go and somebody's got a bit of elbow pain and whack in a cheeky needle in their perineum, because you're going to have some questions to answer. Hello and welcome back to one of our acupuncture podcast episodes. We're going to continue the theme on the most commonly asked questions around acupuncture. And what I was going to do today, what I was thinking might be helpful, is kind of create a commonly asked questions by patient and clients. So this may be a video to watch if you're somebody who's looking to have acupuncture and you've never had it before. It might be for those of you who are clinicians and are looking for some, like, a fairly easy to answer questions that you might be getting for your clients or patients, or you might even signpost them to watch this video, right? Because let's face it, who wouldn't want to see this face? So let's get cracking on. So first up, is one session of acupuncture worth it? Short answer is no. If you're going for acupuncture, there is a chance that you need one session, right? And I can think of probably on one hand, in all the time I've been acupuncturing as a clinician, as I've been teaching people acupuncture, and in the times I've been doing it as a researcher, I can probably think on one hand how many people have got benefit from just one session. And what I mean is not that people don't get any benefit after one session, but that they get more benefit from doing more sessions. So is one session of acupuncture enough? I would say as your default answer, no. I would always go a minimum of 4 sessions. And the reason for that is that acupuncture is cumulative, so it often takes a few sessions to, in some cases, to get going. So you might not have no symptom changes at all for the first couple of sessions. But in other instances, it builds up and it builds up and it builds up. So you might get some benefit after session 1, bit more benefit after session 2, even more 3, 4, that kind of stuff. If I give it a minimum of 4 sessions, and after the 4th session, there's been no change to symptoms, we knock it on the head, acupuncture isn't for you, it's not going to work, it's less likely to work, even though some of the literature says keep on going for up to 10 sessions, I think it's important to kind of acknowledge that probably on balance of things, if after 4 sessions it's not making any difference, we'll move on to something else. The next question is very similar to this. How many sessions of acupuncture do I need? So this is a really good way to gauge it. Minimum 4, there is no maximum. How you can gauge when to stop having acupuncture or providing acupuncture is when the benefits stop increasing. So if you imagine that you're on a curve, right, and you're better than last session, you're better than last session, and you're better than last session, and you're better than last session, and then you get to a point where actually you know better the next time compared to the last time. Not saying that you've reverted all the way back to the original point, but you've kind of gone up like this, like this, like this, and now you've plateaued off. So you were just as good as you were before the last session. That's the point where you say, do you know what? We're done now. Okay, we don't need to keep on going. So that's how I see it with a lot of like pain management, for example, is that are symptoms improving from the last session? If they are, let's keep going. If they're not, if they're still good, but there's no more improvement from the last session, you've probably hit your plateau. There are a couple of exceptions to this. So there are scenarios where you may continue with acupuncture because it's helping to maintain symptoms. So in my first bit of serious data collecting research in pregnancy-related pelvic girdle pain, what you find with pregnancy-related pelvic girdle pain is that you would expect symptoms to progressively get worse over time, particularly when you get into the second trimester, end of second trimester, into third trimester. You're expecting pregnancy-related pelvic girdle pain to progressively get worse. So if somebody's not changed pain intensity from one session to the next, that's probably a good sign. It's probably the equivalent of actually we're making a positive difference, because what you'd expect normally is that symptoms to get worse, but because the symptoms haven't got any worse, you're actually onto a good thing. The other bit I would say about how many sessions is that often in things like overactive bladder management, headache management, there'll be like a big kind of dose of acupuncture, 6, 7, 8, 9 sessions at the beginning, and then people gradually space out the time between the sessions. And then when you get to a point where you've hit that plateau, booking in, say like 3 months or 6 months in advance is something which can be really helpful, because if the symptoms do come back, and in a lot of cases in chronic problems like headaches with overactive bladder, symptoms do come back, you've actually got your safety net there. You've already got a session booked in, and so you're hopefully going to catch it before your symptoms come back raring and horrible again. So having that kind of 3 months or 6 month booking is great. And if you don't need it, you can cancel it or you postpone it to the next 3 months or 6 months. So that's where I would go. There's not really a maximum on sessions, but I would say a minimum is about 4 sessions. Next question, is 20 minutes enough of acupuncture? Yes and no. And it's not me sitting on the fence. There are some people who maybe only need 15, 20 minutes. There are a lot of people who need a lot more than that. And I think that if I was in a scenario where it was either having acupuncture for 20 minutes or not having it at all, let's do it. Let's give it a go. Let's see how you respond to it. If it's a scenario where I could opt to keep the needles in for longer, absolutely, I'm going to keep the needles in for longer. All right. And if you come back into my clinic and you either know better or you've had no adverse events to acupuncture, I might look to increase the dose. And one of the ways you increase the dose is by leaving the needles in for longer. So is 20 minutes long enough? For some people it is. For some people it isn't. If you can go for longer, go longer. If it's a difference between not doing it at all or doing it, do it and do it for 20 minutes. See how they respond. Is acupuncture worth it? I perhaps have a slight bias to this, given that I have a training company that trains people to do acupuncture and dry needling. But if we put that aside, is acupuncture worth it? Yes, it is. If you're a clinician, you will see that private practices up and down the country are providing 3 techniques. By and large, they're providing a manual therapy, they're providing an exercise-based therapy, and they're providing a needling therapy. The reason for that is, I think it was like 2012, there were over 4 million needling sessions that happened in the UK alone. And that was like over 10 years ago, right? So nearly 15 years ago. That number is definitely bigger now. So that's telling you that lots and lots and lots and lots of people are finding benefit from acupuncture and dry needling. There's something like 56,000 searches on Google every single month for acupuncture treatment. So again, that's telling you that people really, really like it. So even if we kind of get away from the data element of this, is it worth it? Well, lots and lots of people are looking for it, so they must place some value in it. I know that's a very scientific way of looking at it, coming from somebody who does research in acupuncture, but I think that does carry some sway to it and carry some weight. What is the most powerful acupuncture point? Well, depends on context, but I think if we're kind of going to go for the big hitters, you've got stomach 36, which is in your shin, so one sun lateral to your tibial tuberosity. That's the big hitter for like general well-being and general health in and around your body. You've got large intestine 4 in your hand, so that one there between your first and your second, so your thumb and your first finger. That's the big one for pain management, particularly if it's severe pain. So that would be a super duper one there. And I think I've got to give a courteous nod towards liver 3 in your foot as well. I mean, it has a huge list of things that it's supposed to be related to. It's particularly in things like migraine and headache management. And given that headaches and migraines affect 1 in 7 people, which is a monstrous number, I think it needs to be put in there. And by the way, if you're interested in migraines and headaches and how acupuncture fits into that, we've got a whole episode on that earlier. So go and check that one out on our podcast. What are the forbidden points of acupuncture? All right, this is a bit of a controversial one indeed. So there are some areas that kind of make common sense, right? So you've got 1 here, stomach 1 under your eyelid. It's not forbidden, but let's not stick needles in there, man. That's just mental, right? We're not going to do that. We've got 1 here called bladder 1. Don't stick needles in the tear duct, right? Just leave it be. You don't have to go there. We've got some in the perineum. They're not forbidden, right? And if you are working in pelvic health, they make perfect sense, okay? But let's not just go and somebody's got a bit of elbow pain and whack in a cheeky needle in their perineum, because you're going to have some questions to answer on that one, right? So they're probably the big ones. Needling over the thorax and the abdomen carries a more significant risk of adverse event than, say, needling in the limbs, but they're not forbidden points. And I'm kind of... I'm not saying skirting around the subject, but I'm kind of leaving the biggest bit to last, or the most controversial bit to last, because traditionally speaking, when people talk about the forbidden points, stomach 17 is in the nipple. And it's supposed to be something that you don't needle. I've never felt that I've ever needed to needle the nipple. And so I'm quite happy to say, well, although it's not a forbidden point, just don't do it. But like in the tear duct, right, on your eyelid, just don't do it. Not necessary, right? The other ones are related to pregnancy. So you have a collection of forbidden points that are supposed to induce labour. Spleen 6, liver 3, large intestine 4, gallbladder 21, and there is another one. I'm going to have a look now. Oh yeah, bladder 60 at your ankle. Now, you're probably guessing my take on this, but let me just talk you through this. So these acupuncture points are quoted for inducing labour, which if you're like 42 weeks gestation, great, get that thing out of me. I remember doing my pelvic girdle pain trial, and when people were, 38 weeks, 39 weeks, they were on the trial for acupuncture for pregnancy-related pelvic girdle pain, but they were like, I've heard that acupuncture can induce labour. Can you get this thing out of me now? I will pay you anything. Now, in those scenarios, I didn't do this on the trial, by the way, just to clarify. I did not do that. I didn't do it. No, that would be a big, absolute no, can't do that. However, I do know people who will use acupuncture and those acupuncture points to help induce labour. So we do training courses for midwives, for example, and they'll use a collection of those points to help induce labour. It's not causing the TCM risk here is not that there's anything unnatural happening. It's that to try and stimulate labour. My other take on this, that is just what I've just said here, is that the forbidden points are seeped in traditional Chinese medicine philosophy, which is to say that specific acupuncture points have specific actions. There is not a lot of evidence base to support this idea that specific acupuncture points do specific things. And so it's quite difficult to show that from a scientific perspective, these things exist and these things will induce labour. And I also kind of go along the lines of thinking, well, if it was that easy to induce labour by just putting a needle in around somebody's ankle or sticking in something in the hand, we wouldn't have to be going through a huge cocktail of drugs and procedures to try and induce women in late stage pregnancy. It just wouldn't be that easy, right? Because if it was that easy, people would just be like going into labour just by banging their ankle against the door frame, right? I can't see it being a logical argument. To support us on this, if you look at the use of these points, there are a number of acupuncture studies that participants have been pregnant women, and the pregnant women have had these acupuncture points needled in them. So what springs to mind is one study or a couple of studies by Eldon in the mid-2000s looking at pregnancy-related low back pain, and used a collection of these so-called forbidden points, and there was no adverse events recorded. We did a systematic review, which makes us feel very old now. It was published 10 years ago now, 2015. The very first bit of research that got published along with two of my colleagues. And it was looking at the safety of acupuncture in pregnancy. And there didn't seem to be anything in the published literature that suggested that there was any such thing as forbidden points. And I kind of take it on this way, looking from a traditional Chinese medicine perspective, is that acupuncture is there to facilitate the body's actions and functions. In traditional Chinese medicine, acupuncture won't cause harm unless you do something to physically puncture an organ like a lung with a needle. It won't cause any harm. It's about restoring balance and harmony. So if this point is supposed to induce labour, it would only induce labour if it was needed. I.e., if you're in second trimester, labour's not needed, then it just becomes inert. It doesn't do anything. Whereas if you were at like 40 weeks and you were due to go into labour, then it may then activate it. But that is very much traditional Chinese medicine, and that is my take, if you like, on traditional Chinese medicine philosophy, in that acupuncture points don't do these things every single time consistently. Acupuncture points and what they do, although I like that idea, isn't supported by scientific Western evidence base. That's not to say that they don't do those things, by the way. It's just that we haven't got any evidence to say that they do those things. And also, I think that the context of this is that when you're reading these manuals, the context of what acupuncture points do are that they do these things when the body needs them. And so if somebody is pregnant and if they're in their first or second trimester or early third trimester, they don't need to go into labour, and therefore those acupuncture points are inert. They don't do anything. So that's my take on it. There was a paper done, I think early 2000s, maybe mid 2000s, which kind of give a bit more of a kind of biological reason why these things aren't likely to be a case. So I don't think that the forbidden points are really a thing. I don't really buy into it. I know some people do. And if I'm honest, and if you're working with pregnant populations and that's not something that you're that comfortable with doing it, don't do them. You've got plenty of other acupuncture points that you could use. There's loads of them out there. So, no sweat, just don't do them. What I would say is, though, that I wouldn't be saying this if there was anything that was compelling out there, or there was even a suggestion that these points specifically did these things. Okay, so who is not a good candidate for acupuncture? I think people who are very nervous or needle phobic aren't necessarily people I would say don't have acupuncture with, but I think they've got to feel very much empowered and that this is their decision. You don't want to be putting this on people, on anybody, right? You don't want to be just dropping this on, say, oh, hey, do you fancy some acupuncture? Yes, great, stick a needle in. People got to have time to consider this. So we need to make sure that we're giving true informed consent. We're giving people the information prior to having the needling done. So that should be an information leaflet that gives the pros and the cons, or the potential benefits and the potential risks to being needled, and so they can go away and make an informed decision. So I'm not actually saying that people who are afraid of needles are an absolute no. I've needled many people who are like that. Plenty of our courses, we have people who are really nervous about being needled and they still go ahead and do it. So that in itself isn't an issue. I think people who are not good candidates are ones who are looking for like a complete resolution of symptoms. And this probably goes for any therapy that we're doing. If anybody's kind of saying, right, I'm looking for complete resolution of symptoms, and after you explain the likelihood of that happening, after you've explained perhaps the evidence base or in your personal experience that some people do get complete resolution, some people get a lot of benefit, and some people get a little benefit, and some people get no benefit. I think if people are still adamant that they're looking for complete resolution, I'd be a bit nervous, or not necessarily nervous, but I'd be making sure that I'm making it very clear that I'm not expecting complete resolution of symptoms, because although that does happen from time to time, it's not super common. The other part of this, I think, is that linked into the next question down that we've had, which is about who should avoid acupuncture. You've got your contraindications. So somebody who is unwell, somebody who's got an unstable medical condition. We should be conscious of things like infection to an area. So that's kind of your standard contraindications, right? They're fairly easy. You'll have picked them up on a training course for sure. If you are a patient, if you're a lay person, your clinician will ask you all these questions before you're being needled, right? So there'll be a series of questions that are basically asking you about your health state, and those were the things that you need to be cleared. So those, we'll just put them to a side because they're the obvious ones. You don't get needled in those. I think the other people who should avoid acupuncturing are those who are in a really flustered state. So if you were to come into my clinic, really like you're late and you're running in and you're all, oh God, right, sorry, I'm late, I'm coming in, go out, jump on the plinth and right, stick some needles in. I'm not going to needle you. Not that I'm not going to needle you at all. I'm just not going to needle you right then and there. I'm going to get you to calm down. I'm going to get you to chill out, because I found that you're more likely to have an adverse event, so feeling faint, feeling like you're going to be sick, if you then have followed that up with needling. So I just let people calm it down. Usually I'll have some just chat about symptoms, about how they've been since last time, things that I would normally do anyway, but I'm maybe changing the order a little bit of my treatment session, just so that the person's got time for their heart rate and their blood pressure to calm down a bit. They're a bit more chilled, and then we introduce the acupuncture. The other group of people are people who haven't eaten. So if they're coming to me clinic, particularly in the morning, and they've not had anything to eat at all, they're just more likely to have an adverse event. So I'm not necessarily sending people away, say, see you later, dude. I'm just more like, say, look, get yourself something to eat, get yourself something settled first before having acupuncture. There's been a couple of things that I've tried to look at acupuncture's impact on blood sugar levels, but this is just anecdotally from my experience that if people haven't had something to eat and you needle them, they tend to feel a bit rubbish and, can feel sick and all that kind of stuff. So it's not a very pleasant experience for anybody. So we just make sure that they've eaten something, they've not rushed into the clinic. Those are the people that I wouldn't needle. All right. Oh, so here's a one. Do doctors believe in acupuncture? Well, I could be a bit facetious with this one. So I am Dr. Carl Clarkson, and I believe in acupuncture because I teach it and I talk about it a lot. But granted, I'm a PhD, so I'm a researcher rather than a medical doctor. And I suspect that that question's more related to medical doctor rather than PhDs who really have no benefit to saving your life whatsoever unless your life-saving problem is to do with some kind of philosophical debate. That might be of some help to you then. Okay, so a medical doctor, do they believe in acupuncture? Yeah, there are, right? And I think that to kind of like say broad strokes, do doctors believe in this, that, or the other, would be inaccurate. And anything that we would say, I would hope to say that doctors, if you were to say, do doctors believe we should help people? I would imagine that pretty much everyone would say yes. But when it comes to treatment techniques, they're all going to have their own take on things. But there is a society that is dedicated to doctors, so the British Medical Acupuncture Society in the UK. There's a lot of medics in that. It was started up by medics and run by medics, okay? So there's a very strong group of people who think very strongly that acupuncture is positive. There are a number of researchers who are medical doctors as well, who look at acupuncture's effect. There are lots and lots of doctors that we get on our courses. We have anaesthetists, we have consultants, we have dentists coming on our courses, and they're using it in their clinics day in, day out. You see the other things which is related to this. So we see a lot of GP referrals for acupuncture. We know that there are, particularly in things like palliative care and oncology, there are referrals specifically for acupuncture. In pelvic health, it gets used loads for overactive bladder. But like anything, you're going to have people who are against it. And I think that those people who are against acupuncture usually stem from a couple of areas. One is what they've heard about acupuncture is more the TCM descriptions of meridians, yin, yang, and qi. And I totally get that, right? If you're not done any training or any deeper learning into acupuncture from a Western philosophical perspective, and all you hear is about yin, yang, qi, meridians, when you've been trained in a Western philosophical approach of medicine, that just feels a bit too woo-woo, right? And I totally get why on the superficial layer, if somebody that's all they've heard about acupuncture, it feels like it's not real, okay? Where in fact, there's actually some good science behind acupuncture. So there's some good physiological evidence base, and there's a number of randomized controlled trials and systematic reviews with meta-analysis say, you know what? Acupuncture's good. So yeah, so in summary, yes, there are some doctors who think it's great, and yes, there'll be some doctors who think, no, don't do that. Oh, what is the pain level of acupuncture like? I remember years ago getting a tattoo done and, you're chit-chatting to try and pretend that I'm not in absolute agony, all right? I remember my tattoos, like, when I was saying, I do acupuncture, I was like, oh, I've heard acupuncture is absolutely knacks, it totally kills. I'm looking at this dude, right? And he's like tattooed head to toe, right? Literally on his skull tattooed, right? And I'm getting this thing done on my back. I'm like, how can you say that acupuncture absolutely knacks when you've had all these tattoos done? Because acupuncture is nothing like getting a tattoo done. So we kind of had a bit of back and forth and stuff. But in effect, acupuncture shouldn't be painful, right? If an acupuncture or dry needling needle is going close to a structure that your body doesn't want it to be close to, it'll give a certain set of symptoms. Sharp, scratchy, super intense, like I'm going to be sick in your face, all right? So super intense, sharp, and scratchy. And that's not to say that the clinician's done anything wrong, far from it, right? That is just like, we don't know where all the structures are underneath the skin. We know where the big ones are, the big players. And in fact, like, getting close to a nerve or blood vessel is no big deal, right? Literally zero big deal at all. And so you might feel sharp, scratchy, really, really intense sensation. But what then your clinician would do is adjust that needle, and they would change the position of the needle and what have you, so that sharp, scratchy sensation doesn't persist. And you're talking in a matter of like 2 seconds, okay? So it definitely shouldn't be painful. What you may find, though, is strong sensations. And strong sensations are actually desirable. So ache, tingling, warm, spreading. There's a whole host of descriptions that people will give. And they're actually a positive. We're actively looking for those sensations. Now, some people will call that pain. And that is because usually when we're presented with an unfamiliar sensation, we'll use the word pain to describe that sensation, where if we kind of just scratch the surface of that, what do you mean by that? It's actually more collective of these other sensations, which are actually a positive thing. But nevertheless, that this is not going to happen without your say so, right? So like if you're getting that and that sensation is too much, clinician will just take the needle straight out. Okay, so it's nothing to worry about. It certainly shouldn't be painful as in the sense of like super sharp and scratchy. It might be very, very briefly, but the clinician will adjust the needle. That's normal, and that will happen even to people who are my level of experience, because I'm kind of a big deal, right? And even me, that might happen to me when I'm needling somebody, all right? But yeah, so it's nothing to worry about, no big deal. And to be honest, the vast majority of an acupuncture session, you're certainly not in pain, but you should expect to feel a sensation. All right, guys, so there's a second podcast episode on the most commonly asked questions of acupuncture and dry needling. I hope you found that helpful. If you're a clinician, that might be something that you can use as some descriptions for your patients and clients. It may be something that you direct your patients and clients to this podcast, because the most common questions they're likely to ask, and they're hearing it from someone like me who researches this and does this a lot and teaches it and so. Or you may be a client or a patient yourself. You might be a lay person. You're thinking about acupuncture, or you're just curious. You're not sure about this, that, or the other, and you think, oh, what is this? So hopefully that's answered some of your questions. If you do have more questions, or there's anything else that you'd like us to cover in subsequent and future episodes, drop it in the comments section, all right? I say this on the end of every single podcast. It makes a ginormous impact when you like, comment, share, follow. Honestly, I can't emphasize how much of an impact this has. So if you are enjoying this, if this is something that you'd like to see more of, if it's kind of, you want to have some influence and impact on what we do here, please like, follow, share, comment, do all those things. And, that'll help us to understand what we need to do more for you. For now, see ya.